Have you or a family member ever had shortness of breath, chest pain, or even a heart murmur? If so, your doctor may have ordered an echocardiogram for you. What is an echocardiogram? An echocardiogram is an imaging modality that uses ultrasound to provide various images of your heart. How does it work? An echocardiogram is performed by a trained specialist known as a sonographer. The sonographer will place a transducer on different parts of your chest, which releases high frequency sound waves. The transducer then picks up the echoes of these sound waves and transmits them as electrical impulses. The electrocardiography machine then converts these electrical impulses into pictures of your heart. The cardiologist can then use these images to diagnose what potential heart diseases you may have. Today, we want to talk about a specific type of echocardiogram known as the Go POCUS machines. POCUS stands for Point of Care Ultrasound. Currently, there are over 100,000 devices on the market, but due to their convenience, this number could increase to 800,000 in the next few years. But before we go any further, let's talk about what POCUS exactly is.
Point of care ultrasound, or POCUS, is an important tool that physicians can use in emergency situations to diagnose a patient where they are located, whether that's an ambulance ride, an emergency helicopter ride, or even the intensive care unit. Expediting triage and time to diagnosis have been shown to be crucial to decreasing morbidity and mortality in critically ill patients. Therefore, when POCUS is used in these situations, it can answer specific clinical questions and aid in diagnosis much more rapidly. However, due to the nature of POCUS, medical specialists using the device must be extensively trained in ultrasound use to minimize the required time to obtain and interpret images in stressful situations. Therefore, POCUS presents several risks to patients, say, for example, that are experiencing time sensitive cardiac arrest, when attaining good quality ultrasound images is difficult. And this can be for several reasons. This could be due to lack of training of the sonographer present, patient physiology that decreases image quality naturally, or other difficulties navigating the ultrasound probe to the proper location at the proper angle. Any delays in image acquisition, as well as poor quality of acquired images, place patients at risk for potentially fatal adverse effects. Continuing the example of cardiac arrest, increased POCUS image acquisition time has been shown to delay start to compressions and increase interruptions during resuscitation. Ultimately, a faster method to acquire higher quality ultrasound images would reduce patient risk and increase diagnostic capability.
So, based on my experience with working with Dr. Rogers in the clinical setting, I was able to witness a lot of ultrasound procedures. And the biggest thing was there was no set way of doing this. And for each patient, there was this trial and error period, which took about 15 minutes in order to get the perfect image. And that time is really significant. And you can imagine in emergency settings where the ER tech is trying to get a good quality image quickly. And if that's not done, it's results in a lot of consequences.
So, our new statement centers around addressing the poor quality of ultrasound images taken by technicians and medical professionals to improve the quality and significantly reduce procedure time. Currently, there is a poor quality of point of care ultrasound images that are taken in emergency situations and in training. This problem predominantly affects biomedical technicians, clinical providers, medical students in training, and allied health professionals that work under time sensitive constraints. The ideal outcome is to provide live feedback on the ultrasound image capture. This would ultimately reduce the time that it takes to locate and position ultrasound probes during training and help aid in the reduction of time it takes to form a diagnosis by clinical providers.